One of the tests that we have here at FamilyWise is something called, or that we offer here at FamilyWise, is called the CIMT test. It's the carotid intimal thickness test. What it is, it's an ultrasound of the carotid arteries to show us if there's an accumulation of soft plaque. It's important because soft plaque most often is the one that kills us. Calcified plaque, while it's still scary, is often more stable. And so in a proactive approach, we want to be able to identify the soft plaque prior to it causing problems. Your body's smart. It wants to protect the brain before it does the heart, because if this isn't working, it doesn't matter what's going on here. And so this is an early detection sign. Even in some studies, it detects coronary artery disease even prior to our calcium scores and other diagnostics that we have out there. Here you'll see an artery, and the most important thing that we want to see here is how plaque accumulates in the arterial system. This pink layer here is called the endothelium, and we want to make sure that this stays as cool as possible. Now, there are various illnesses that can cause inflammation there: heart attack, diabetes, high blood pressure, diabetes, gout, rheumatoid arthritis, lupus, obesity, and some others. So cholesterol is just one of the many things, or one of the many variables that can cause inflammation to this layer here. So when there's inflammation to this intimal wall or the endothelial wall, white blood cells will actually go here to try to fight it off as though it were an infection, try to cool down the inflammation. As they die, they make foam cells, and these foam cells accumulate and start to make plaque. So as soft plaque develops, you'll see the progression here from a normal artery to what's called a fatty streak. I don't know if we can see this inside here. And as this fatty streak starts to go over the endothelial wall, it starts to form plaque. When the plaque starts to develop in the outer wall, it actually pushes the two inner walls closer together. So it's a misconception that we've had in our society. We've always thought bad cholesterol builds up like sand in an hourglass, and it doesn't. It actually pushes the walls apart, and in doing so pushes the inner walls closer together.